upstate New York University Hospital in Onondaga County near Syracuse, who came down and came to work here on Long Island at Stony Brook University Hospital to join the fight and the battle where it's happening in an effort to save people's lives. And that was incredibly inspiring. There were cheers as they walked in, and it really felt like the cavalry was coming. And that is a wonderful statement about who we are in New York. As I had mentioned, I called the county executive there, Ryan McMahon, and thanked him for his support of that, of those nurses coming down. And so we've seen that, but there are others who are coming as well. We saw reports earlier today of a Montana resident, a nurse for 20 years who had retired to start her own business, Kim Yarrow, who has been assigned to a hospital here in Suffolk County, who decided to come out of retirement and again answer the call where it was needed. These people, these nurses, nurses in our system, on a normal day, they are the unsung heroes of our medical system. The work that they do every single day in our hospitals and other healthcare facilities is so critical, and we're so grateful for their work. But during this crisis, the nurses and what they have been doing, we cannot say enough to thank them. We cannot express enough gratitude for the incredible sacrifices that they are making. So it's good to highlight some good news. I want to highlight some other good news that we're seeing in the numbers. We're always cautiously optimistic when we talk about numbers, but yesterday we spoke about this being Holy Week and Passover and Easter. It is a season of hope. It is a time of hope, and there's a lot to be hopeful about, even in these dark times. And so we'll take a look at a couple of good things that we're seeing in the numbers. The one statistic that we've been following very closely and have said that it is an important measure of where we are is the hospitalizations. What do they look like? The number of people or the trend line of admitted patients with COVID-19. That has continued to go up, and it is still going up. So today we have 1,658 people who are hospitalized. That is up from yesterday, 16 patients with COVID-19. So it is still going up. But if we just take a look back on where we were the past week versus this week, a week prior, we were going up an average of 144 patients, COVID-19 positive patients, in the week prior. In this past week, that number has gone down to 35, averaging 35 people a day. Now, again, that number is still going up, but there is a big difference between averaging 144 in the prior week and averaging this past week 35. And over the last 24 hours, that number is 16. That's fluctuated up and down over the last week, but it's staying relatively in that range, the average 35. So we'll be looking forward to this week and hopefully seeing those numbers down. And what I would love to see is, for the first time, that number actually go below. Not that we're just seeing a slowing in the rate of increase of patients with COVID-19 hospitalized, but the actual number starting to go down. The other number that's positive for us to talk about today is the number of people being discharged from the hospital. We saw in the last 24 hours the highest number of people being discharged from the hospital, 160 patients with COVID-19 discharged in the last 24 hours, going home to complete their recovery at home. Now, these are the patients acquiring the virus or contracting the virus who were the most sick, who required hospitalization. 160 of them going home in the last 24 hours. That is great news. It's the highest we have seen. And it is, again, I think a measure of where we are going. So we're seeing the rate of increase on hospitalizations slow, continuing to go up, but definitely lower than it was the week prior. significantly. And we're seeing the number of people being discharged with COVID-19 going up. That is great news for us to be thinking about this week. And it by no means should suggest that we're changing course or that we should be changing course in any way. But we should look at the numbers realistically and say that is a very positive sign. That is a good thing. We have a long way to go, but we're seeing some positive trends here. So on some of the other numbers, the number of positive cases that I reported yesterday I want to make a correction on that. We reported 20,320 cases. I can actually report today 20,321 positive cases. So the number yesterday was incorrect. We discovered a glitch in the automation that was essentially double counting certain individuals. So from the state data, there are patients who come down who have more than one lab report. So that was being counted twice. So our IT team discovered that, corrected that, and that was happening over the last few days. They corrected that. The number yesterday should have been 19,246. And the number today is 20,321. So again, up more than 1,000. But that is the correct number as of about 1:30 today, 20,321. Again, I want to thank our IT team for the amazing job that they've done in automating this process. That would have been impossible for us to provide a granular level of detail that has helped inform some of the decision making we've made with respect to things like hotspot testing and starting that up. So I want to thank them for the great work they did and thank them for making that correction. Our IT commissioner, who's on the phone, Scott Mastellon, and his team have done an amazing job. And just one small example of the great work that's happening inside this government from the public servants here who are responding to the virus. On some of the other numbers, the ICU beds, we did see an increase today. That number has gone up and down over the last couple of days, but it was an increase today of 18, so we're up to 541 at this point. So again, that is compared to the prior week a positive. When you look at the ICU numbers and how they have gone up, that number has come down significantly. We actually, over the past few days, have seen the number decline in real terms, number of people on ICU beds, but over the last 24 hours, that number has gone up by 18. Hospital capacity is 3,404 hospital beds. That's actually slightly lower than it was yesterday. A couple of hospitals reported a lower number of hospital beds that are part of the capacity. That's likely just an anomaly, and we'll see where the numbers are tomorrow. ICU beds are continuing to go up. We now have 771 ICU beds in the county. That's an increase of 13 beds. And overall, we have 651 hospital beds that are available. 112 ICU beds are available as well, and that's in the overall system right now. So we have that bed capacity still. And of course, the worst part of providing this report on a daily basis is talking about the number of people who have died from COVID-19. That numbers continue to rise. We know as long as hospitalizations continue to rise, that we're going to see this number go up. And today, that number's gone up to 458 over the past 24 hours. That's up 44 from yesterday when it was at 414. And again, to all the people who have been impacted by this virus, the family members who have lost loved ones, all of those who have been impacted, you are in our thoughts and prayers. We are thinking about you every day. And all of the people on the front lines, they are fighting so hard to save as many people as they can. And I want to thank them for the work they're doing. Part of that effort to save lives is multifaceted, of course, but is something we've talked about over the last week, is our hotspot testing, where we're trying to communicate and message and help protect the health of some of those communities that have been really hard hit by the virus, going by that data. And we set up 3 sites over the past week. We've been developing this planning over the last 2 weeks. We're able this week to get 3 sites up and running in Huntington Station, and then yesterday in Riverhead and Brentwood. And I want to thank the supervisors who really we worked closely with at these sites, Supervisor Lupinacci in Huntington, Supervisor Aguiar in Riverhead, who helped connect us with Reef Technologies that has provided tenting and logistics support, and Supervisor Carpenter in the town of Islip, where we are utilizing their site in Islip. So I want to thank them. As I mentioned, we are and have been planning to do additional sites. So I can announce that we will be opening additional sites in Wyandanch and North Amityville. And we will be doing that at some point later this coming week. As soon as we can get those up and running, we'll have more details in the next couple of days. But I want to thank everybody who's been involved in this effort to get the hotspot testing up and operating. It is very important that we are identifying these places where the rate of the virus has been higher, and so that we're in a position to use testing as a way to message to these communities about protecting their own health and the health of their families, and connecting them to resources and giving them all the information that they need to help protect themselves and everyone around them. So I want to talk about also what's happening in our schools. We've talked a lot about the schools and the work that they've been doing. We've been communicating with the School Superintendents Association and our school districts from day one of this crisis. And the partnership there has been terrific. And I want to thank all of the school superintendents. I mentioned the other day our peer-to-peer COVID challenge, where students are putting out messages to their fellow students about the importance of staying home. So we worked with the schools on that. But the schools have done a great job in getting out meals to the kids that need them in their districts. We know the kids rely on those meals during the school year, so that when the school districts were closing, when we put that order in place, that was one of our big concerns, making sure that would continue. So I can tell you to date that more than 770,000 meals have been distributed by our schools. And in the past week alone, that number is 254,000 meals. That is extraordinary. They're doing a terrific job. They're doing grab-and-go meals mostly, but some of the districts are actually delivering meals to the students. This is vitally important. And again, I want to thank them for what they're doing on that issue. I also want to highlight, I mentioned earlier, the contributions that are being made by so many individuals. We are going to win this battle against the COVID-19 virus by doing it together, by everyone coming together in our community and doing their part. And we all do have a part to play in winning this battle. And I have been inspired by the acts of generosity, the heroism and bravery of so many people in this fight, and the people who have been doing the right thing, following the health guidelines, social distancing. All of those things are essential workers who've been out there doing great things.
And that was Suffolk County Executive Steve Bellone. Says he's happy to see the number of hospitalizations are going down and patients leaving the hospital are going up. The death rate, though, that is also going up. And now County Executive Laura Curran has an update in Nassau County. Let's listen in to her.
County residents who have succumbed and died from COVID-19 jumped 69 from this time yesterday, for a total of 792 residents who've passed away. Now, I feel that I need to address this because there is a discrepancy. Sometimes the media reports a number that is higher. That higher number, is people who have died in Nassau County of COVID-13. As we know, there are residents from other counties who are passing away here. So the number that I am giving you is the number of residents who have passed away, Nassau County residents who have passed away, and these are state numbers. Our hospitalization numbers are as follows. COVID-related patients currently in our hospitals in Nassau County, 2,430. That's an increase of 5 from yesterday. Discharges are 275. In the last 24 hours, 275. So again, for the 6th day in a row now, we're seeing significantly more discharges of COVID patients than new patients coming in. On ventilators, we have 481 patients on ventilators in our hospitals. That's an increase of 4 from the day before. In our police department, we have a total positive count of 138. So that's our police department, village and city police as well, sworn and civilian. In quarantine, we currently have 161. Cleared are 170. That's a good number. So 170 police personnel have been cleared, and that's more than the 161 currently in quarantine. Sheriff's Department, we have 51 positive, 77 in quarantine, 47 cleared and back to work. Inmates, we currently have 19 positive, 5 pending results of testing, and 16 cleared. Our fire marshals have 2 more positive for a total of 3, and 4 in total have been cleared. Now, I know the hot topic today, people are asking about reopening schools. When do we get the economy moving again? When do we get schools open again? Well, guess what? Schools are part of getting the economy moving again. This has to be done in a regional manner. It has to be done in a methodical manner. It has to be based on the data. We in Nassau County are a very important part of a robust regional area and a robust regional economy, part of the tri-state metropolitan region. So we're not an island unto ourselves. Our schools are not islands unto themselves. Businesses are not islands unto themselves. We have to do this in a way that is regional, that is methodical, and that is well thought out. You know, right now it's hashtag in this together. 400 years ago, the poet John Donne would have said, we are all part of the Maine. So I support 100% Governor Cuomo's regional approach. I know he's talking to the governors of Connecticut and New Jersey to make sure that we're doing in this a methodical and regional way. It also has to be done, I know this keeps Dr. Larry up at night, it has to be done in a way that we don't see a spike in new cases, because we know with new cases comes more hospitalization and more death. So again, we have to do it looking at the data, looking at the numbers, working together as a region. I know that we're all itching to get back to normal. The sun is shining today. A lot of us are getting ready to celebrate Easter tomorrow. If you are feeling overwhelmed, anxious, if you have addiction issues that you're struggling with and you feel very much alone, I want you to know that you're not alone. You can always pick up the telephone 24/7, call 516-227-TALK if you have a domestic abuse situation that you're in. 227-TALK. Pick up the phone, give us a call, and we'll point you to the resources that can help you. For a bright spot, our donations continue to come in. I want to give a special thanks to the Nassau County Police Foundation, Home Depot, Costco, BJ's, Henry Schein, Scott's Miracle Grow, Hagedorn Company, and many, many others who have stepped up with donations and with help. Also, last week I called on our residents to shout out local heroes, and we've gotten a tremendous response, so please keep them coming. I think we're all looking for bright spots, and then when you send these to us and we post it on social media, it really does show that we are in this together. Please keep them coming, whether it's your deli guy, your bagel gal, your good neighbor next door, a seamstress that you know who's making masks. We know our libraries are using their 3D printers to make those face shields for first responders and for hospital workers. Let us know. Let us know the good things that are happening, how we're coming together. You can let us know through social media, hashtag Nassau Hero, or email us at heroes@nassaucountiny.gov.